We'll go ahead and get started here. Um, Hello and welcome to the informational webinar about the new Masters of Healthcare Analytics and Operations program offered by Iowa State University's Ivy College of Business. My name is Kim Putz and I'm the Assistant Director for Graduate Recruitment. I will be facilitating our discussion today. During today's event, we'll tell you about the features of our program. We'll be monitoring the chat throughout the webinar. So if you have any questions, please feel free to put your questions there in the chat. Let's get started with some introductions. This is Scott Prow. He is the chair of the Department of Supply Chain Management in the Ivy College of Business at Iowa State University. He is also the Robert and Jane Sturgeon Faculty Fellow in Business and Associate Professor of Supply Chain Management. His research and advisory specialists include shipper 3PL relationships, logistics innovation, on-site representation, and performance measurements. His research has appeared in leading supply chain journals, and he teaches courses in strategic logistics management and international trade. Scott also spent several years managing supply chain operations for Target Corporation and Polaris Industries. He earned his MBA from the University of Minnesota and his PhD from the University of Oklahoma. Scott, now, if you wouldn't mind, let's hear about the new Masters of Healthcare Analytics program. And if you have any questions, feel free to put those in the chat as Scott goes over the program.
Great. Well, thank you very much. I'm going to go ahead and share my screen here. Typically, when I present, I say, go ahead and interrupt me if you've got questions, but that's kind of hard to do in webinar format. Kim, will you keep an eye on the chat box if somebody asks a question, and then feel free to yell at me or scream at me if you need to get my attention to talk about this program. So, and thank you for the introduction, and thank you everybody for joining us. I know we've just got a few people on here, which actually makes it fairly easy to keep it somewhat informal. Please answer or ask any questions that you've got, and I'll be happy to answer them. So let's start off with just a basic overview of the program. Now, I want to get ahead of a couple of the questions, because people will often ask about, tell us about, people who've been through the program before, what are they doing now? Well, the really cool thing about this program is it's brand new. And it's brand new, and it's not just the brainchild of a few faculty. This is a program that was developed mainly because we received some really good feedback from executives and healthcare leaders and directors from across the country with regard for the need for a better understanding of healthcare supply chains. How do supply chains impact the healthcare industry, and how can we better manage healthcare supply chains? And then analytics. How can we use analytics to improve our operations? And what we've done is we've created a program that really ties these together. How can we give students the analytical skills to go forth and improve operations? And when we say operations, we can touch on a number of different things, and I'll go through that as we go through this presentation today. So hopefully everybody can see my screen. I'm going to go ahead and jump to the next one. Just real quickly, my computer is telling me that Kim, you are the one that's speaking. Can everybody hear me okay?
I can hear you, Scott. And my recommendation, if you could, do you want to put that on like a PowerPoint view so we can see the slides to the side? So if you want to do maybe like a full screen.
I can do that. View. There it is. Oh, down there. How's this?
That's good for me, and I can hear you. Let's see. Emily, can you hear Scott okay? Can you give us a thumbs up? Oh, Michelle
Okay.
is up good on her end. Perfect.
All right.
Thanks, Michelle.
Good deal. So the program is 100% online, 100% online, asynchronous. So what the asynchronous means is that it's not going to be scheduled meetings, say Mondays and Wednesday evenings or Tuesday evenings. The material is going to be presented to you online. It's not self-paced. There's going to be basic expectations that you're, hitting deadlines each week as we go through it. But you're going to work through it within the week, when you've got time available. But exams will be done online. There'll be homework that you'll do on your own, turn it in, and then the instructors will grade it. There will be lectures are often delivered through YouTube. So we'll create videos, post them online along with several different readings and PowerPoint and other resources available for you so that you've got access to them as you go throughout the program. It's going to provide you with the ability to do analysis, interpret healthcare data effectively so that you know what the data is telling you. Provide you with the opportunity to support health systems, insurers, other organizations to work more efficiently. It's not just about the hospital setting or about the long-term care setting. This is really aimed at a very broad healthcare perspective. So that way, if you're going to go work for an insurance company, for a small clinic, a large medical practice, or a network of facilities, we're providing you with the tools that you need to do that. And of course, sharpen your problem-solving skills and gain a deeper understanding of healthcare. The audience that we're looking for, entry to mid-level healthcare professionals. I've talked with some physicians about the program, physicians who are looking to move into executive management of facilities that want to have a better understanding of how they can provide better patient care. Looking at analytics to show, how can we minimize times in waiting areas? How can we make sure that we're being more productive with the time available, from our physicians and from our nursing staff and others to make sure that we are spending as much time working with patients as we can. Analyzing data to improve healthcare institutions in the areas of patient care, running day-to-day operations, and I would say upstream operations when you think about pharmaceuticals and drugs and so forth. How do we best manage those supply chains so we can get them into the hands of the patients with as low a cost as we can. Again, we'd like to provide you with tools that you can increase your earnings power and professional growth. Again, it's about building the skills in the tool set so that way you can go ahead and make an impact on your own employer or make that shift into a new career path. And again, this is a very fast growing and I would say fast changing industry. Year in and year out, when you take a look at the professions that are poised for the most growth and have the greatest need, there's always healthcare positions posted there on those lists, and we're just trying to provide the tools that way students are better prepared for those jobs. In terms of the structure, it's a 15-month program, 30 credit hours. There's links here where you can check out the different course offerings, but we do offer courses in analytics. We do offer courses in supply chain management. We've got electives that touch a number of different areas. A couple things to note here with regard to the program structure is we are creating courses specifically for this program. So you don't have to worry about just taking a supply chain 301 or an analytics 301 class where we're giving you textbook examples from Walmart and Amazon and these big box retailers or manufacturers. We're creating the courses with examples from the healthcare industry. We're creating the courses with faculty who've got some healthcare experience, either practical work experience, or they have developed a research program that requires them to spend a lot of time with healthcare professionals. So these are people who understand the industry. So that way you're learning from people who know something about the healthcare environment. One of the other nice things about this program is we expect to see people from the healthcare industry participating. So even online, as you engage in discussions and back and forth with some of your classmates, we're hoping that you can learn a lot from one another as well. So if you're working in a hospital setting and you've got somebody else in the program that's working for an insurance company, and you've got somebody else that's doing home health care, as you share information and share experiences and how the content that you are learning applies to that specific situation, we're hoping that you can expand your learning that way as well. Again, in terms of student demographics, there's a number of different. We're looking at pharmaceutical firms, public health, medical groups, clinics, nurses, physicians, healthcare executives, chief medical officers. These are just a sample of some of the people who have expressed interest, either formally or informally, in the program, or these are positions that we've talked with healthcare executives that have indicated that, yeah, we could see a real need for people in these areas to take courses in this area. Again, you can complete our 100% online program directly from wherever you are, for international students and so forth. I don't know if we've got any international students on the webinar today, but a couple of things just to take note of. It's not a STEM program, so if you're looking specifically for something that's STEM, I know that's something that a lot of international students are looking for. This is not going to qualify as a STEM program. There's no GRE or GMAT required for admission. So if you're thinking about, most graduate business programs do require some sort of a GMAT score. We don't require that for this. Tuition and fees, again, 15-month completion plan. The total tuition and fees should come in right around $25,000. Again, with the hope being that using the tools and skills that you acquire, that you can see that career growth and the payoff down the road. There's not always going to be an immediate, yes, here's a $25,000 bonus for completing the program. It'd be great if we found companies that were doing that, but take a look at it more from a skill set standpoint and what you can do with the skills that you're learning through the program. Application requirements. Again, there is an application. There's a link to this application. I believe you guys have access to these slides. We'd like to see a resume. We'd like to see where our students are coming from. We do like to get a diverse group of students because, again, if we've got everybody from the same setting going through the program, it really limits the amount of learning that you can do from one another. And it puts all of that learning on the content that you're reading and the homework that you're doing and what you're getting from that instructor. It really is more valuable with a more diverse student group. So that's why we like to see the resume. College transcripts, we do require that you have a bachelor's degree. So if you're currently working toward your bachelor's degree, you would actually have to have that finished up before you start in this program. It's not something you can start and work through concurrently like some other graduate programs are structured. We do look for 2 letters of recommendation, statement of purpose. Why are you interested in pursuing this degree? And then for international students, TOEFL and other scores. Kim is on the call. She's certainly a fantastic resource. You can contact our graduate programs office. Phone numbers are there. There's information available online about the program. And again, there's email addresses here as well. So we've got a lot of people who can answer questions for you. If you're going to ask, if you're lining up a bunch of questions with detailed inquiries about what's being taught in some of our analytics courses, I may not be the best person to answer those. If you've got supply chain questions, I can jump all over those, but or anything about the program in general, I'd be happy to answer as well. So I know I went through that fairly quickly, but if you've got questions, I'd be happy to answer them.
All right, so this will be the time now. If you have any additional questions, go ahead and put those in the chat, and Scott or I will definitely be willing to answer those for you. There's a couple of additional areas I'm just going to touch on a little bit further that I've gotten some inquiries on in the past few weeks as far as people interested in the program. So in regards to the structure of the program, we talk about a 15-month completion plan. So that 15-month completion plan is the suggested fastest route to completing the program. With the program being 100% online, you can take that at a slower pace if you would prefer to do that. And Scott could jump in, but from communication with the professors, that 15-month completion plan is a very quick and not necessarily the most recommended path to following to complete the program, but depending upon your situation, where you're at in life as far as family, workload with your current employment, things like that, that is an option that is available to you. But just keep in mind that you do not have to complete it within 15 months. You can spread that out to a longer completion plan slash term. Let's see here. Sorry, we're just reading a question in the chat real quick from Michelle.
Okay, so is it possible to get the SCM certificate and this degree? Yes. Yes, you can. So it's similar, I mean, with our MBA program, we do have students in our MBA program who will graduate with the MBA, but want to add on some of these supply chain courses as well. So if you're going to load up with some of those extra supply chain courses, you can graduate with both. Yeah, I would say, since this is a program that actually has operations in the title, it is a supply chain program along with analytics. You don't necessarily need to have that on your resume, but it certainly would work. Anybody who takes those classes and can put it together can also tack on that certificate. Great question, though.
Great question. And yeah, you would just work with both the advisor, which is Emily Schwartz, and then with Scott, or the director of the program, and then they would work out a plan where the classes fit for both the certificate and the program. But as Scott said, it seems that he thinks that that would definitely be a great option and that could be possible. A couple other questions that we've gotten similar from graduate prospective students is typically like, maybe how many hours a week do you typically spend on the courses? This program is new, so it all depends on your skill set and how knowledgeable you are in the different areas. As Scott has mentioned, it hits on 3 main focus points as far as analytics, the supply chain operation side, and then the healthcare side. So there might be some courses that are more challenging to you than others. So those might take some additional time, but in a nutshell, feedback from current students and other graduate programs are typically around 10 hours a week for that. I also know we've had some interest from some current ISU employees in this program, so I just want to mention that on the website there is information about the tuition reimbursement program within Iowa State, and that is typically 4 credit hours per semester, so fall, spring, and summer. If you guys do need a little bit of information or an email address to get more information regarding the Iowa State tuition reimbursement program, I can provide that to you to reach out to HR. For anybody that is not an ISU employee, we do work with companies as far as their tuition reimbursement plans as well. Iowa State offers tuition deferment because most companies will want to reimburse or pay for the course after it has been successfully taken, and you can provide a passing grade for that. So we do have plans to where you can defer that tuition cost to be able to provide your grade to your employer. So we do work with all students on those with their companies and with them as far as if they're planning to use tuition reimbursement to cover the cost of the master's program.
So there's a question about creating a certificate in this program in the future. I don't expect us to, at least not in the near future. It's hard to create certificates for multidisciplinary programs because certificates, if you're familiar with the supply chain certificate, it doesn't require a large number of courses. With this one, because you've got to have the supply chain background and the analytics background, and then weaving in some of the healthcare as well, it's going to require more classes in order to get what we would feel comfortable with, calling a certificate or any type of a degree. It's hard to create much difference between the full degree and the certificate. I understand the desire for a certificate because it is something you can achieve much faster in at a reduced cost as well, because it doesn't require as many courses. But we want to make sure that you've got the full background from an academic content standpoint with this. So we may at some point, but there's no plans for it in the immediate future. One of the things that we also want to do is we want to make sure that that we're really striking a chord with the industry with this particular degree as well, and generating some interest in in this particular area, because again, like I said, we hear from healthcare executives that this is an area poised for a lot of growth. So we're just trying to meet the needs of the market without oversaturating the needs of the market by offering the degree and the certificate and too many other programs at the same time.
Scott, could you touch on in the course listing about the professional the experience piece of the program, kind of what you're looking for, whether specific areas of people currently working, or kind of talk on that piece a little bit?
Yeah, so there's a professional experience component to this, and essentially what we're looking for there is an opportunity to apply what you're learning in the classroom to your current work environment. So if you're working in a healthcare setting and you can apply the concepts from a couple of the classes and demonstrate this is how we've made changes, or this is how this impacts this particular aspect of what I do, then we're going to give you academic credit for that. So this is if you think of some Master of Science programs that require a creative component where you're writing a thesis, we're not that type of a program. We want to give much more credit to the academic or the practical experience that you bring to this program instead.
Great. I'm going to do one last call here to see if there's any additional questions from the attendees. If there is, if you can go ahead and get those in the chat, and we'll try to get those answered for you.
Is the experience portion graded? Yeah, more pass fail. It's not going to be, and again, brand new program. We haven't gotten to this part yet, but yes, I mean, we're going to have certain expectations with regard to what it takes to meet the expectations for that practical experience. We haven't completely fleshed that out yet. And the tuition reimbursement part requires a grade, not pass fail, to be reimbursed. If that's the case, we would make sure. Yeah, I don't think it's going to be a PF. It will be a. Try to think of the best way to it's going to be one of those where you're either meeting the expectations and the requirements and you're getting, that, that good grade, or you're not, and it's just not going to work, and it'll fail, I guess. But I don't anticipate this being a problem, mainly because you're going to be working with us as you embark on this program, and you're going to send me an email, or you're going to send Dr. Scheibe an email and say, hey, this is what I do. And I've taken a few courses. It looks like I can apply this to what I'm doing. Do you think that'll work for the creative or for the practical component? And we'll say, yeah, just do it this way and explain this and do this, and it'll work out really well, and you would get the full grade on that. So again, like I said, we're still working through the details on this one.
Yeah, to expand on that, I think, they're worried just if it's labeled as pass fail, that reimbursement wouldn't cover it. I think that, just like you said, that's a detail that they'd be willing to work out to make sure that you got a letter grade if it was needed as far as for the reimbursement portion, whether that's ISU or a company. So sounds like that would, just like you said, not be a problem there.
Yeah, we'll work with everybody on those.
These are all great questions coming through from the audience. Does anyone else, or is there any additional questions from the audience? Okay, well, I want to thank Scott today for coming on and discussing the program and going over the details. And I want to thank everyone for attending. Everyone should have received an email from me with the PowerPoint in it yesterday, as well as my contact information. So if you have any questions after this webinar, don't hesitate to reach out to me. And any specific questions regarding classes, as Scott said, feel free to email those to me as well, and I can distribute to the specific people that might be able to answer your question to the fullest. So I appreciate everyone's time, and have a great rest of your day.
Thanks.